Hi, Dr. Ray here with Pro Holistic Care. Today I want to talk to you about pregnancy and chiropractic care. So very oftentimes, just in society by our doctors, pregnancy is often treated as a disease, and it's something that we think we should have all sorts of discomfort and pain and problems with because it's treated as a disease. And really, pregnancy is a natural, normal process. And of course, there's going to be some symptoms related with pregnancy, but you should still feel good. You should have, good amounts of energy while you're pregnant. And one of the things that we really don't want you to have is pain. So pain is very common in pregnancy, but there's a lot of ways that we can help prevent it. And there's a lot of things that we can do to treat it once it's happening. So one of the really important ways that chiropractic care can help with pregnancy is through something called the Webster Technique. So when you're pregnant, the hormones are all over the place. And one of the hormones that's really important for pregnancy is called relaxin. Relaxin is really important because that allows ligaments, tendons, joints to loosen up. If our ligaments or tendons in our joint in our pelvis do not loosen up, we can't fit a growing baby in our pelvis. We also can't birth a growing baby out of our pelvis. But one of the side effects of relaxin and the pelvis being looser is the joints in the pelvis, these big joints here, they can start to get inflamed. So really what the Webster Technique does is it helps us balance out the pelvis and the low back so there's less pressure on the joints, less areas where there's possibility for inflammation and pain to occur. The other really great thing about the Webster Technique is that in balancing the pelvis, we've also seen positive outcomes in better fetal positioning. So trying to avoid having the baby either transverse, occiput posterior, which is what people call back labor, or having a breech presentation with the baby. So baby needs to fit in here. If the pelvis is out of alignment, twisted, that doesn't leave as much space for the baby. The baby kind of has to find whatever position it can get into. So if we have a nice lined up pelvis where it's nice and open and baby can move freely, baby naturally is going to want to go into the position they're supposed to be in. Another issue with pregnancy is low back pain. So we get a lot of that pelvic pain, but also because your posture changes and you start to have more pressure on the low back, women tend to get a lot of pain back here during pregnancy. And that's something that light chiropractic adjustments during pregnancy can help with as well. So if you're pregnant and you want to prevent pain, reach out to a chiropractor, especially a Webster certified chiropractor. I've been certified in Webster for 20 years and have used this with countless numbers of pregnant patients and myself. I'm a mom. I've had 3 kids. I've experienced all of these things we're talking about, and Webster Technique during my pregnancy was super duper helpful. So if you're having symptoms, if you want to prevent symptoms, even before you get pregnant, you can start care to make sure that pelvis is nice and healthy. Just reach out to us, reach out to another chiropractor, and enjoy a happy, healthy, fun, and pain-free pregnancy.